The Alberta pandemic management is getting a lot of attention these days, particularly in the big city hospitals, Calgary and Edmonton. We've interviewed a number of doctors in both those cities. Less attention to rural issues. And we're going to talk to Dr. Noel Grisdale, who's in the Turner Valley Black Diamond area, about consequences of overloading or overstraining the urban centers and what that means for rural practitioners. So welcome to the interview, Noel.
Thanks very much. Thanks for having me.
So we've talked about how this the Alberta healthcare system is organized on a spoke and hub and spoke principle. So if somebody has a serious problem, a heart attack, something like that, you treat them as best you can, you ship them off, you send them to a hospital in the city. What are the consequences if those facilities are stretched to the limit or beyond?
Yeah, I mean, we've got obviously a long-standing good working relationship with the tertiary centers, Calgary obviously being the one close to us, and you know, they're there for us via phone, via STARS air ambulance when we need them for really acute cases. And we in turn are there for them to offload. So we'll take patients when they get full or they're needing to offload, maybe people that can be rehabilitating out in the rural area. We take patients from them. So it is a symbiotic relationship, and there's a lot of angst, I would say, leading it up to what's going on right now in the cities, how that's going to impact us. So far, we haven't had anything as far as a crisis situation, but we're sort of prepared for the what ifs. And those would include if they just don't have access for us from an ICU bed perspective, there is that concern are we going to be dealing with patients that normally we wouldn't deal with in a rural area just because there isn't anywhere for them to go in the city? And what kinds of decisions will we have to make around the care of that patient?
Well, we're hearing some discussion about the ICU beds in the cities. They're doubling up in some cases. There's a question of, are there enough ventilators? And then, of course, are there enough staff? If, for instance, you had to keep patients in your local area, have you got the facilities, have you got ICU facilities with the necessary staff and equipment?
Short answer is no. I mean, we haven't for many, many years. Our hospitals, like many of the rural ones, built back in the Lougheed days, and there were surgical ORs and things that occurred back then, but we've transitioned those beds and places in the hospital for emerge department use, but not for ventilators and that kind of thing. I have a lot of faith in my colleagues who work at AHS and in the city who are trying to plan and deal with those what ifs. And so it'll be a challenge. It'll be interesting to see what we come up with, which are the solutions in case these kinds of things were to happen. I know I just was going to say one thing is the staffing issue is already hitting all of us. I mean, I see what my colleagues are going through in the city. We've had a reduction in beds at one point from 17 inpatient beds to 10 because we had a number of nurses that were off on isolation or had positive results, that kind of thing. So our own staffing situation becomes tenuous because we're smaller and we don't have the volume that we can have our own challenges just staffing our own hospital and our own emerge department.
Boy, oh boy. Now, when I talk to the Calgary and Edmonton doctors, the one thing they really point out, I mean, everybody is just stretched to the limit. They're exhausted after 8 or 9 months of working on the front lines of the pandemic. And they look back over the last week to 10 days and the big spike in numbers in the second wave, and they're just dreading that, those folks who got infected coming, the number they're going to start hitting the ICUs. Are you worried about that?
Yeah, I mean, I think for the average person out in the public, they don't see this, right? And I get it. My friends or people who aren't medical people, it's very hard for them to understand why we're going through all what we're going through when the vast majority of people have minor symptoms, minor illness with COVID. But I think the part that we all need to remember is that it's not just the ICU beds, it's also the people who are in hospital. People's average stay with COVID in the hospital in the city are 2 weeks. There's not a high turnover. And so you have this inundation of new patients coming all the time. into those hospital beds, into those ICU beds. And so we're not getting the turnover. And we know it's going to affect us at some point. We're a smaller center. We don't have the same volume that a catchment area, but it's inevitable. You just do the math and it's inevitable. We're going to have those same kind of situations on a smaller scale. So yeah, to answer your question, I'm concerned. Yeah.
So I guess the last question, Noel, is how concerned should we be? I mean, I've been, beating the drum for this for the last week or 10 days, warning that, because that's what doctors are telling me, that we're on the cusp of a crisis, and this next wave of patients could push us over into crisis. What's your take on that?
Yeah, I mean, you can do all the modeling you want, and you can look at past experiences in other jurisdictions. In the end, I mean, none of us want lockdowns. I've seen the effect lockdowns have on my patients, the depression, the substance abuse, all of these things. But we also don't want to make choices on who gets a bed, or who do we send home with an oxygen tank and say, here's some steroids and I hope things work out okay for you. Come back to emerge if they're not, but we can't guarantee you there'll be a bed for you to be admitted to. And so I guess what I would plea is that people really try and do the best they can to minimize their contact with others, to wash their hands, to wear their masks, to stay home, because the end result is we don't know, and we just don't want those decisions around who gets the bed. That's what we don't want.
Noel, I gather that you haven't had many COVID cases out in your area yet that you've had to treat in the hospital. Is that correct?
Yeah, that's fair. I mean, we've probably had, a handful. Thankfully, a number of them, much like the stats that you see, the statistics were minor symptoms. They might have been patients with comorbidities, but they're very fortunate it didn't impact them. We probably had one over the pandemic where we actually who crashed and went downhill very quickly and had to go to the city for intubation ICU care. So again, on the broad scale, when you look at it, the statistics kind of, or the numbers support our experience. It's just we don't see the volume that the city does. So when we do see somebody real sick, it's not something we're dealing with every day. So our level of anxiety and stress goes up very, very quickly. Yeah.
Neil, thank you very much for this. We really appreciate it.
Yeah, no, glad to. Take care.